Hi, I'm Jim Nasr. I'm the CEO of Acoer, and we're a tech company focused on healthcare innovation and using blockchain technologies. We have been using blockchain and DLT technologies for many years now, and in fact, I've been using Hedera, in fact, pre-Hedera, back in Sorrell's days, since inception. So many years of experience in this. I'm very much a believer that there is a play for layer one blockchains and some of the solutions that we're trying to get to in healthcare, improving health outcomes, improving health equity. At Acoer, really, we have three types of technologies that we have developed. We have applications, and the purpose basically is to improve lives. So as an example, we have an application that we have built that supports essentially public health reporting and in particular opioid and substance abuse. And we work with various counties and states and the federal government to improve public health reporting on opioid related mortality. Another part of our technology is really all to do with using decentralized technologies to connect to siloed health data. Health data is really not in one place. It's really spread in many different data sources. Even an individual's health record isn't really in one place to go to. So this underlying siloed health data is a problem that requires you to be clever in how you get to that data and where it is, ideally at rest, and how do you, in a privacy-preserving way, get value from it, whether it's analytics, whether it's AI, and so we have a technology we have developed called the cryptographic data mesh, which uses Hedera as an underlying means for data verifiability, and we use that technology to connect to these decentralized data sources. And then, if you like, at the bottom of our layer is what we call the Acoer platform, which is a number of technologies we have built, utilities, but really they're, and again, very heavily used blockchain and specifically Hedera for data verifiability, consent tracking, rights tracking, a number of use cases along those things. But we use our Acoer platform as a way to accelerate building the solutions and the apps that I was describing. So that's really what we do, and we're a product company and very much believe that Hedera as an abstraction, as a layer of technology that's abstracted, can be used, and what we are actually using in just about everything that we do. We have a history, really since inception, of doing a lot of heavy analytics, and that's really where we started. So visualizing data, doing analytics, doing reporting on large data, and predictive analytics. So a natural, evolution of that really was, how do we make surfacing this data a little bit easier for the users, a little bit more conversational? Given that our data is decentralized, given that often the data really is private, it's not available publicly, how do we leverage these AI technologies and make the data that they represent reliable, make it explainable, make it verifiable? And the more we've gone down this rabbit hole, the more we've realized that what we really need to do more of is what we call ethical AI. AI that can be explained in some way, AI where we're very specifically trying to track lineage of both the user and AI interaction, but as well as the data integrity in the model, as well as things such as sustainability. Can we do it in a way where the data, the training and the results can be sustainable cost-wise and in terms of impact on energy? So that's really what we've been doing, and over the last year, very much evolving our technologies around this ethical AI and really built on decentralized technologies. How do we get to these decentralized data sources, and which, as I explained a little bit earlier, we heavily use Hedera for, to do, at the very least, to show verifiability or what we think of as cryptographic proofing of where the data is, what the source is, what kind of access we have, and how do we prove what we are doing. So starting from that basis, basically, merging in some of the AI technologies that are out there. We do quite a bit with OpenAI and with Llama and some open source AI technologies, and it's really the merging of the two where, as an example, as a discrete example, we're doing quite a bit of work on organ data. So that data, some of it is public, but it's coming from various data sources. Some of what we have access to is maybe semi-public. But in order for us to really provide value, we have trained various AI models on it. But the data really is not what we consider as conventional, textual data. It's data that we have to do quite a bit of pre-processing to. So embellish with metadata. Again, every time we touch data, we want to prove what we did. Because ultimately, if you can't trust what we did, all bets are off. So that's why we go in the pre-training and the pre-processing. We heavily use Hedera for everything that we touch, including showing the source of origin. But then from there, the training that we do on the model and the results that we're getting and looking at whether the results actually match the factual data that we know about, or working with, for instance, ER physicians, where they're looking at data and giving us direct anecdotal observations on does this make sense? And then from there, so again, we use Hedera significantly in this model training. But then going one step further, where we need to make changes to the model in terms of post-training evaluations. So now we're looking at the results. As example, a very common one, we have a lineage tracking for the user and AI interaction through our chat companions. And if our kind of physician users say, this is wrong, or this data is hallucinated, or it seems like there's some kind of a violation of privacy or patient rights, then we stop that and we retrain the data. But then that becomes a post-training event that, again, we track using Hedera. If AI is something that we want to do that becomes trustworthy, part of this problem, for us, a part of this context is decentralized data and using decentralized technologies to very much in real time prove what we're doing, and when we need to make corrections to prove those changes are being done in a compliant way. We started with Hedera really early. This is in 2017, even before that with Swirls, as I had just come out in a private way. At the time, I think the technology was kind of mind-blowing, and it was well ahead for the use cases we were looking at. And the use cases really were all to do with real-time interaction, where really since day one, we have thought about a public blockchain as a means to impute computational trust. So don't trust Jim or Acoer, trust these proven mathematical computations and proven public cryptography. So at that time in 2017, it really was leaps ahead of most of its competitors. I think now, circa end of 2024, like suggested, there are comparative and competitive technologies, but we've really stayed because of the community. So we came because of the technology, but we've stayed because of the community. One of the things we have seen is that this community really cares about Hedera, about not just the kind of the premise, but also the promise of it, like the potentials, and not just for, I would say, conventional cryptocurrency use cases or DeFi, but also for things that seem a little bit left of center, such as the work we're doing in healthcare and public health. What use cases and where in the world you're trying to make an impact? So as an example, if we're talking about the health use case, and if we're talking about the payer kind of community in the United States, there are some significant barriers to entry there, and not really what you would consider as a beachhead if you want to prove out blockchain. However, if you took that same scenario and put it into, say, sub-Saharan Africa, like Kenya as an example, and look at health equity as your driver, and look at underlying kind of context of a population whose average age is 19, who is very, very savvy with mobile technologies and very willing to move on to a blockchain technology for innovation, for improving their lives, materially improving their lives. Then I think the barriers to entry are things like starter kind of investment, having an accelerated team that really can deliver, and actively working on these kind of use cases outside of just, if you like, DeFi or meme coin and cryptocurrency, because I think there's a lot more value that you can find. So I think context is really, really important, and you have to really very specifically know what the industry context and the kind of the geopolitical and kind of environmental context are you thinking about. We are really a whole different new era of statistics, we're able to do things that we really couldn't. We're even able to do brand new AI models outside of just like, if you like, transformative. Things that we really couldn't conceive. We can think about AI agents and human embodied AI and all kinds of use cases I think people see value in. So then, to me, where is the promise for DLT is, well, DLT, if nothing else, can be a way, a blockchain can be a way to enable a more democratized, a better governed, more decentralized way of doing AI. Because I think I would hate for us to have this conversation in a couple of years and we say, well, look, AI world is again back to the 4 or 5 top tech firms because they have the most amount of compute resources. They are the ones who basically effectively own the data. That would be a terrible thing. We don't want to repeat that as we have with the internet. And effectively all AI becomes a product and we become a product of 4 or 5 big tech companies and billionaires. With Acoer, what we see really is an opportunity to basically take health data and make it connected in a verifiable, cryptographically provable way, which may sound fairly simple-minded, but is actually quite a difficult and complex challenge, and the data is really big, and it's not kind of normalized. There's a lot of our lingo pre-processing to be done. To go from there to this, how do you get value from this data? How do you accelerate human-centric solutions where we can directly improve human outcome? And that's really our focus. In terms of where we're going, we really see an opportunity to scale. I think that's the phase that we're in with our business is scale. So we're looking forward to whether it's financial scaling or whether it's use case scaling, to kind of be hitting that in the next couple of years.